Thank you. All right. Well, good morning. Thank you so much for joining us all today as we introduce the 12-month Contraceptive Care Act, which will strengthen women's health by promoting consistent and effective birth control use. Let me start by saying what all of us are here for specifically. Nearly every woman in their life will use contraception at some point. In order for birth control to be effective, it has to be taken consistently at the same time every day. Yet in Wisconsin, women either have to fill their prescription on a monthly basis or every 3 months. This creates barriers to access, and our goal is to ensure that every woman who wants consistent access to birth control can do so. That's why Senator Harris Dodd and I are introducing the 12-month Contraceptive Care Act legislation that will allow women to receive a 12-month supply of birth control. There is no medical reason why a woman should only receive a monthly supply of her birth control, and this bill will remove any unnecessary barrier to access. So why is this important? When it comes to effective birth control use, consistency is key. In fact, research has shown that dispensing a 12-month supply of birth control at one time reduces the odds of unintended pregnancy by 30%. It also reduces abortion rates by 46%. The CDC and the World Health Organization both recommend 12-month birth control prescriptions for this very reason. Almost all women have relied on birth control at some point in their lifetime for their health or for family planning. With many women using contraception for 3 decades or more, it just does not make sense for them to have to run to the pharmacy every 30 or 90 days. If they have an issue with transportation, childcare, work schedules, they may fail in getting to the pharmacy on the right day, and they run the risk of an unplanned pregnancy. They're especially at risk if they're low-income women, work multiple jobs, live in rural areas, or don't have access to reliable transportation. It's 2016. It's time for 12-month birth control. Currently, 62% of women in the U.S. use contraception, and 99% of sexually active women will use contraception at some point in their lives. In addition to preventing unwanted pregnancies, many women use birth control to manage serious medical conditions, for example, endometriosis. Our bill has several safeguards in place. It would first require a person to fill a 3-month supply of birth control, and the legislation does not apply to contraception that would expire or become ineffective in under 12 months. Our legislation is modeled after a bill that was successful in Oregon, which was the first state in the nation to pass 12-month birth control. Since this legislation passed in Oregon with overwhelming bipartisan support, I hope to have real conversation with my colleagues across the aisle to urge their support for a crucial issue for women. This shouldn't be a partisan issue. Most of the women in this room know how vital contraceptive access is to ensuring they can control their fertility and determine the course of their lives. Birth control represents economic freedom for women and their families, and it's essential to women's health and the health of families. So we're so proud today to introduce the 12-month Contraceptive Care Act for co-sponsorship. We look forward to having an important conversation in the legislature about strengthening birth control access with our colleagues. Next, my colleague and co-author of this bill, Senator Nikiya Harris Dodd.
Good morning. I'm State Senator Nikiya Harris Dodd, and I represent the 6th Senate District. This bill eases access to safe, preventative medication without the added burden of visiting a pharmacy or clinic every few months. This bill is especially important for low-income mothers who may have to pick up their children from school after work and don't have the extra time to swing by the pharmacy. Many mothers in my district work multiple jobs. Between coordinating school schedules and multiple work schedules, even the smallest trip to the pharmacy can be an added stress. This is especially true if a mother does not have access to a vehicle and has to rely on a bus schedule to get around. A 365-day supply will bring down the cost of co-pays, streamline the pharmacy process, and reduce stress for women across Wisconsin. This also saves substantial money in healthcare costs by reducing unwanted pregnancies. According to a University of California San Francisco study, when low-income women who rely on public coverage of contraceptive contraception receive a 1-year supply of birth control pills. Rather than a 1 or 3 month supply, the pregnancy rate decreased by nearly a third. I am going to repeat that. The pregnancy rate decreased by nearly a third. This means we can reduce unwanted pregnancies, save healthcare costs, and ensure that women have the tools they need to make important decisions at a time in their life that is right for them. I am proud to co-author this important piece of legislation to provide women across our state with access to safe preventative medication. And at this time, you will hear from Dr. Cynthia Anderson. Hope I pronounced your name correctly.
You did. Thank you very much. You're welcome. Good morning. As an OBGYN physician, I care for reproductive age women and girls day in and day out. It's what I do. It's what I love. It's my privilege. And it's often not recognized how complicated their lives can be, working multiple jobs, caring for special needs children, struggling with finances, mental health issues, caring for aging parents. The list goes on and on. Helping women to prepare for the right timing and the desired number of pregnancies is a critical piece of the puzzle of their complex lives, and it's something that I love to help with. An unplanned, a mistimed, or an unwanted pregnancy can have devastating health, financial, and emotional impact that ripples throughout families. When a woman experiences an unintended pregnancy, she's less likely to get early prenatal care. She's more likely to be engaging in unhealthy behaviors during pregnancy that can seriously impact the health of her developing fetus, including smoking and alcohol use. She's less likely to complete her own education, less likely to achieve her financial and professional goals across her lifetime. And still we know that unintended pregnancy accounts for 50% of births in our country, 50%. This is preventable and it's costly. As a physician, I feel we are systematically failing women and their families when it comes to contraceptive access. There's certainly no medical reason why contraceptives should be dispensed for only 30 days or only 90 days. To ensure the health of women and children, in fact, the safest birth interval is 24 months. That's 2 years. This legislation would create a critical change that we can and should make. For those women who've already chosen a modern form of birth control, having a 12-month supply would certainly reduce the unnecessary burden on them of struggling to reorganize their complex lives, putting aside their work and their family responsibilities to wait for refills and trek to pharmacies and struggle with transportation. It would help ensure that women have a continuously available supply of the contraceptives they chose and that they need, avoiding unnecessary interruptions and continuous contraceptive use. But most importantly, in my experience as a clinician, this legislation would improve the opportunity for women to have the children at a time when they're physically ready, when they're socially, emotionally, and financially prepared to raise their children in the best possible environment. And with this legislation, my patients and their partners and their husbands and their children and I would all thank you. And now I'd like to introduce Hannah Wagner.
Hello. My name is Hannah Wagner, as she said, and I grew up in rural Westfield, Wisconsin. I'm currently an undergraduate student at UW-Madison, majoring in Human Development and Family Studies, Gender and Women's Studies, with a Global Health Certificate. As a student about to graduate, thinking about my future and the potential for graduate school, I have found birth control has become critical in allowing me to follow my dreams and make them a reality in education, in my career goals, and in my personal life. The current process to attain birth control can be daunting and difficult to maintain because of time, travel, and money, only yielding the limited amount of pills you can receive at a time. It is because of my experiences as a woman undergraduate student in Madison and a citizen of rural Westfield that I understand the need to access an entire year supply of birth control at one time, and I support this bill. Growing up in Westfield, Wisconsin, I lived an hour from Madison, 45 minutes from Stevens Point, and 30 minutes from Portage, Wisconsin, which also had the closest Walmart. My small town of just over 1,200 people did have its own pharmacy, but with the stigma around birth control and the necessity of a prescription to even get the pills in the first place, it was very difficult to feel comfortable going to my local pharmacist. I was also concerned about my parents knowing I wanted birth control, so I needed to seek it out on my own. In addition to my own fears, many of my peers shared these feelings while simultaneously facing other barriers to access. They worked part-time jobs while in high school and paid for their own gas and cars, making it difficult to set aside the time, let alone the money, to go get a prescription and then drive to pick it up, similar to the concerns of many working adults who are juggling schedules. As a result of this, I didn't have my first experience with birth control until I was a sophomore in college. At the time, I had finally gained the courage to pursue birth control for myself after having moved out of my parents' house for just over a year and been in college for a year as well. I wanted birth control to help me get through college, to hold off my plans for a family for a few years, and to regulate my otherwise unpredictable period. I knew that I could get affordable birth control at Planned Parenthood without judgment, so I blocked out time in my schedule so that I could take the bus 20 minutes to the health center, spend over an hour there to set up insurance and be seen by a physician, and then take the 20-minute bus ride back to my apartment. After I got my birth control, I thought everything was well and done. But I hadn't avoided having to go to the pharmacy to get my prescriptions because Planned Parenthood would send me my 3-month supply in the mail each month. However, after the first 3 months, I realized that I had to worry about where my birth control would be sent. While I was still in school, this wasn't an issue, but over the summer, when I was in and out of my apartment, I would be worried that I would miss my next package of pills, that my parents might find out, or that they would get lost in the mail. Had I been able to get all 12 months of pills at one time, I wouldn't have had to worry about any of this. This bill has the potential to eliminate so many of the fears I felt around my healthcare growing up and now. If I have to face the shaming pharmacist, I would only have to do it once. If I had to drive 30 minutes to Portage, I would only have to do that once. If my pill was up for the month, I'd have the next one ready to go. I think that this bill has the ability to provide many women with the peace of mind that they will have all 12 months of their pills at one time so they won't ever miss a pill. However, one of the greatest benefits will be the reduction in travel time to and from the pharmacy for high school and college students, for working adults, for mothers, and more. For someone from a small town especially, the reduction in travel can save a lot of time and money that they can devote to their car payments, to rent and food, or their family, rather than monthly trips to seek out their pills. So I ask you to support this new bill in an effort to support women in their pursuance of birth control, allowing them to make better use of their time and money in receiving all 12 months of their birth control pills at one time.
Well, thank you so much, Hannah. And at this time, we would like to welcome any questions you may have.
State law saying you have to do it every 3 months, or is this medical policy? What?
The insurance provider decides whether it's 30 days or 90-day supply that you get right now. The bill would require insurance providers to allow the filling of 12 months.
Okay, so it's an insurance policy. The proposal is
Yes.
trying.
So if somebody who, let's say tomorrow their birth control prescription expires, or I should say, let's say it's 8 days from now, their birth control prescription expires, and today is the only day they can drive to Portage to get their prescription. Well, they would be a day too early, depending on the insurance, and they'll turn you away and say you either have to pay cash or you're going to have to come back tomorrow or whatever day of the week that they're available if the pharmacy only has limited hours. So you can see, I've heard from women, and I know personally that there are times when you can't make it to the pharmacy that day, or you have 1 day out of 10 that you can make it to the pharmacy, and unfortunately your insurance won't cover it because you missed that window. So this essentially allows women to pick up their prescription in one go. They get 12 months of birth control, and essentially they are in charge of their destiny. It's a great idea to make sure that everyone can apply it consistently.
You can't have 12-month birth control with like an IUD, and I've read stories that a lot of the younger women prefer this. This bill, I mean, why is this bill necessary, and does it only apply to the pill?
This legislation covers the pill, patch, or ring, and I'll let the doctor talk more about why for some people birth control is a better option than an IUD.
So you're right, there are other forms of birth control available other than the pill, the patch, the ring. We also have IUDs. There's 3 different brands that are approved right now, and there's also a subdermal implant. And there is a trend, and there's increasing awareness in the community about these more long-acting methods. But we have a full spectrum of contraceptive methods available, and it's really about what's best for that woman based on the need for the contraception, the duration that she's going to be using it, how soon she might plan a pregnancy, whether or not one of these long-acting methods may be a good choice for her, other medical complications. We really want to be able to provide the full spectrum of contraception options for all women and let women and their doctors make a choice that's best for them. So certainly, if it's strictly for contraception, those long-acting methods can also be a part of the mix, but they're never going to fulfill the needs of all women.
Maybe one of the authors could address this. Abortion rates in the state have been falling. Why this? Why now? Is there some background or impetus?
Well, this bill isn't just about abortion. This is about women's health, holistic women's health, and access to comprehensive care for women. And part of it is making sure that women who need birth control can apply it consistently. In order for birth control to be effective, they have to take it at the same time every day. And when Oregon has led the nation, we saw Oregon leading the nation and making sure that women can have 12-month birth control. We thought, this makes sense for women everywhere, and we should really, in Wisconsin, commit to it. I think it's also important to note that this especially helps young women, who Hannah outlined many different barriers that she saw. She waited many years to even seek birth control because of those barriers, and this will help young women gain access to birth control, which for many of them does represent economic freedom. Any other questions? All right, well, thank you all for being here. We appreciate it.